We approach climate change with a focus on where we can create the greatest impact. Responding to climate change is central, really, to providing care and value to our patients and our communities.
I initially started covering this issue sort of sporadically, a Lyme disease outbreak, or a spike in cases in Connecticut, and then a fungal pathogen in the desert Southwest. And it was only recently that I discovered that all of these things are very much connected, that rising temperatures and worsening weather patterns and hurricanes are stirring up and moving carriers around the US in ways that are unpredictable and break through our public health defenses.
I've replaced health equity with health justice in my work often because people understand it. They feel this word justice. Unfortunately, a lot of the folks who are marginalized, people who come from this experience, we know what it feels like to be denied justice. And so when we think about this word justice, that is a way to really call people in to understand that that's the work that's required. So when we think about health equity, it's more than just a word, it's also this set of ethical and human rights principles.
Really central to the work that we're trying to help health departments prioritize and focus on. Again, many do not have the resources, so there's quite a bit of guidance as well on leaning on partnerships to help extend capacity for this kind of work, working with nonprofits in your area that can help facilitate community engagement and can help facilitate some elements of this work that really do take a lot more time and trust.
So after the aftermath of Hurricane Ida in New Orleans, a group of nonprofits, this included Crescent Care as a health center, as well as faith-based nonprofits and other nonprofits in the community, got together and they said, this hurricane was horrible. People died. What are we going to do about it? So Crescent Care as the health center has installed solar panels and backup battery systems so that when a hurricane happens, when a heat event happens, when the power gets knocked out in New Orleans, which is unfortunately all too common, people are able to ideally walk to one of these community lighthouses, which is a resilience hub, to receive services from food to primary care to shelter. So right now we have 27 different health centers who have completed installations of solar panels and backup battery systems across the United States, but this number is going to pretty much double. We've been able to work with Eco America to establish a Climate for Health ambassador training that is tailored to health centers and highlights health center stories.
The climate crisis is real, it is global, and it is also local. It is here right now, and the impacts are striking and they stack and layer on top of existing health disparities. Health centers and health departments are uniquely positioned in their work and their commitments to health equity to address this crisis. You're already doing this work, whether you know it or not. And so really broadening the lens and bringing in more resources and more action are really what I feel is the next step. And it's so energizing to see both how institutions like Sun River Health and the national organizations are rolling out new resources and tools to support this work.